Okay, go ahead, Karen.
Hello, everybody. Welcome to our annual, well, it should be semi-annual Carrier Summit. I'm so sorry we're not meeting in person, but I'm so happy that we're actually having one this year, since I think the last time we had it was like over 3 years ago or something like that. So, as you all know, LACERS has always made it a priority to improve and encourage a healthy lifestyle for our members, as well as work with our carriers to improve disease management. In the past, we've implemented this through LACER's strategic plan via improved reporting and working together with our carrier partners to inform members of various benefits that are available to them. In 2024, LACERS will be conducting its long-term strategic planning. One of the proposed initiatives is to increase partnership with our carriers. Many of you already have programs, so we are partnering with you to gather and share ideas to further enhance the LACERS Wellness Program. Looking to 2024, we understand that there are a lot of challenges ahead with rising cost of labor and services. So it's even more important that we work together to manage diseases and to form a robust wellness plan for our members. Thank you for attending this year's Carrier Summit and looking forward to a greater partnership in the future. So now I'm transferring it to Neil, our general manager.
Good morning and welcome. Thank you, Karen. Good morning and welcome to the 2023 Carrier Summit. It's truly an honor and a privilege to join you together this morning and to express the gratitude and appreciation that we have for your unwavering support and partnership in serving our LACERS retirees. Today is a celebration of collaboration and a testament to the power of working together. And this really just goes to help improve the lives, again, of our members and beneficiaries. Your presence here today is a reflection of that strong commitment. I want to take a moment to acknowledge the tremendous impact that each of you has had on the lives of the LACERS retirees. Your services, your dedication, and your innovative solutions not only provide essential benefits, but also comfort, security, and peace of mind. In the challenging times that we have had and that we still have, your partnership has remained a constant source of support. Your dedication ensures that every retiree, every individual feels valued and respected. As you know, LACERS, our mission is to protect and grow our trust fund and provide excellent retirement services to our members in ethical, reliable, and efficient manner. This can only be achieved through the strong relationships and partnerships forged with carriers and consultants like you. Your commitment to the retirees and your understanding of the unique needs have made it possible to create a retirement experience that is both fulfilling and dignified. Now is the time to strengthen those bonds of partnership that have proven so essential to the success of LACERS and our programs. We look forward to engaging in thoughtful discussions, sharing insights, and exploring new avenues for collaboration that will further enhance the retirement experience for our beneficiaries. Together, we are making retirement not just a phase in life, but a celebration of a lifetime of service. I wish all of us a productive and inspiring summit. I wish we were in person, but we'll do the best that we can here with this virtual meeting. I look forward to our conversations, our collaborations, and innovations that will undoubtedly arise from our time together. Thank you once again for joining us this morning. And here's to another year of partnership, growth, and success in serving LACERS retirees. Please enjoy the summit. Thank you. I guess we're passing it on to Mariah next.
So, hello everyone, my name is Mariah Park-Rosa, and I'm a health management representative with TUNIT, and I will be leading you all through today's fun and interactive icebreaker activity. So, on our screen to the left, we have a painting called The General's Family by Octavio Ocampo. And for this activity, look at the painting and try to see how many faces you can find. Since we're all joining today through Zoom, I'll give you all a few minutes or so, but once you have your answer, please put it in the chat. So I'll set my timer for about a minute and then you can hit the next slide after that to show the answer. It's a little tricky. All right, so a minute has passed. Before I show the answer, does anyone have or feel brave enough to unmute themselves and share what they really think the answer is before we continue with the slide?
Mamar, I'm with Aaron. I've only seen like 3 or 4. I don't see how people are seeing so many.
That's with my glasses.
10 plus the doggy?
So the dog does not count, but that is smart. All right, we can go to the next slide. All right, so if any of you all guessed 9, you are correct. Some of them were definitely a bit trickier than others, but you all did super great. So for this activity, it's more of a reflection on how sometimes we have to step back to see the bigger picture. Now, my question for you all is, how can we truly step back today to see the bigger picture for our LACERS Well program? I'll pass it along to Robin Rager. Thank you all for participating.
Thanks, Mariah. And I think probably I can answer some of that question with the presentation that I'm going to do here, this first part. I'm Robin Rager. I'm a health management consultant for LACERS. So nice to be here with you this morning. Thank you all for attending. I wish I could have met with you in person, but for now, this next best thing. So Danielle Keenan, one of our other team members, and I, we each attended a wellness conference recently. I attended the HERO conference, which is the Health Enhancement Research Organization. They do a lot of research in wellness. And Danielle attended the WellCOA conference down in San Diego, which also looks at wellness applications and best practices. And I don't have very much time today, so I just picked 3 things to highlight as takeaways from those conferences that I'm going to share with you that I think have implications for retiree health and well-being, even though they were really primarily focused on an active employee population. But I think that this has some concepts that were presented that we can look at and get some ideas, maybe look at some bigger pictures when addressing the health and wellness needs of the retiree population. Next slide. So one of the things, we've had a lot of buzz over the last, couple of years in particular with diversity, equity, inclusion, and belonging. And I think this kind of just extends it a little bit more. This is based on a presentation that was done by Mitch Martins, who actually heads up the wellness program at Huntington Health over in Pasadena. And he did a presentation at the WellCOA Summit that Danielle attended. And the takeaways from that was looking at the Gallup engagement hierarchy. So Gallup has a 10-question questionnaire that they do, and they're looking at belonging. And one of the things that came out of that, the surveying that they did, was an urgent call for social well-being. And we've kind of heard this again and again with the retiree population, that people are starving for connection and they're lonelier now than ever before. And we see that, I think, in the retiree population as well, especially coming off of COVID, where they weren't able to interact. And we still see some, I think, residual effects from that. So, and meeting the members' needs through the Gallup engagement hierarchy of belonging. So if we look at this hierarchy, you start down at the bottom, the base, the basic needs. So if you think, sort of, most of you have probably seen Maslow's hierarchy of need, and this sort of matches up to that a little bit. So basic needs, and one of the basic needs that they assessed with this engagement hierarchy questionnaire was, how can you free yourself from unnecessary stress and focus on yourself as basic needs? So what do I get out of life and my health and well-being? And then the next level is, what do I give? So we've talked about individual contributions to help them grow. Again, helping the individual to see their value and know themselves, what their individual contribution can be. And we've encouraged our LACERS members to participate in volunteer activities, as an example, to help, in terms of what they give. The next level is, do I belong? So looking at, again, that belongingness that is important to them in terms of, not feeling isolated and lonely. So how can they see their importance? Are people hearing them, or are they being recognized? And I think we can do that a lot through some of the programming that we have through LACERS, the LACERS Well program. And then lastly, how can we grow? So how can they be challenged? How can you help support their contributions and their feeling of, self-worth and self-value? So I think this was a good concept takeaway that we can apply further with LACERS. And then we've done some of that. Maybe we can look at other ways that we can do that through our programming. Next slide. Focusing on the entirety of life. I thought this was kind of an interesting concept. Retirees, and I think all of us, we look at the past, we look at the present, we look at the future, and we sort of silo them. And what this presentation focused on was looking at the entirety of life. And so there might be some kind of programming or discussion, something that we can do with our LACERS members that helps them to look at themselves as, sort of their life integration. So life's wholeness and the collective presence. I'm looking at the whole time, past, present, and future, as one seamless, ongoing whole. So I thought that was an interesting concept, and we might want to even contact Joel. He does presentations for different groups, and it might be something of interest that we could perhaps have him come in and do a webinar for the retiree population. I think that's a really interesting concept. Next slide. So health literacy, we've talked about this, I think, a lot in the past, but I think it's even more important now. This was a presentation that was done at the HERO Forum, and looking at addressing the core elements of health equity. So, and how health literacy fits into that. So health disparities, health literacy, social determinants of health, and personal determinants of health, all are core elements of health equity. So getting, equitable health care and health solutions to all individuals. So this focused on a next generation health literacy 2.0. And that's based on the elements that we're seeing that we have in terms of new technology and new applications, and applying behavioral science using gamification, personalization with sort of data analytics and AI types of approaches, and interactive media content to address diverse learning needs and preferences. So really sort of ramping up the literacy using the technology that we have available to us. Next slide. I'll just go through these quickly because we don't have much time, but this is sort of, again, looking at health literacy is a problem, and particularly among senior retirees. There are a lot of issues with them understanding, what they, how to navigate not only the healthcare, but also other wellness solutions for them. Next slide. So health literacy 1.0 is sort of what we have right now with, the typical, communications that we send out, written communications or digital communications, and also, the billing and how we, can help them to interpret, in better ways, when they get, bills, how do they understand what that billing means to them? Next slide. Those with low literacy, they have, they're more likely to report their health as poor, have higher hospitalization rates, less frequently get mammograms and flu vaccine, that have difficult understanding and acting on health information. So that's another reason why this is something I think we should focus on more intently, maybe over the next year or so in our programming. Next. And this is just showing moving from 1.0 to 2.0, where health literacy plays a really important part in terms of health equity and health literacy. Next slide. And again, bridging the gap between and taking health literacy to the next level, we're moving, through, again, those concepts that I mentioned before: behavioral science and gamification, technology and media content, multimedia content, and data analytics and personalization. That's something I think that we can further address and look into and pursue over the next couple of years. Next slide. I think that's the last one that I have from this presentation. So I know we delivered this report at one of the recent back meetings, but this is a really quick overview of what the Health Management Data Report for 2022 has included in it. And again, a very limited amount of time to do it, so I just did the highlights real quickly. Next slide. And actually go to slide. Next one. Okay. So this is data that we collected from Kaiser and Anthem, because we had the richest data sources from those two plans. And it looked at health risks, lifestyle-related chronic health conditions, condition management, preventive care, and member engagement. And it was for the 12-month period of January 1st to December 31st, 2022. We also looked at multi-year comparisons from 2018 through 2022, where we had that available. And we can use these metrics to identify the high health issues and cost drivers that are the primary ones among LACERS members, track the health management resources that are available, how they've been using them, or the ones that are available to them, and guiding the development of health management strategies so we can optimize members' health. Next slide. So I'm actually, not going to go down through all of the slides. It's in the slide deck for you to take a look at, but I think there are no big surprises in terms of the findings from the data analytics for the 2022 report. We still have obesity, high blood pressure, diabetes, and depression and the effective management of those conditions that have been diagnosed among the members. Those are the top health issues that still continue to plague us in terms of the members' health. We've had the effects of the COVID on the pandemic on use of healthcare. They're going into visits, them addressing their personal health needs. We'll see some fluctuations over the past 3 years. It'll be interesting to see now, post-pandemic, if what the trends look like going forward after that. But we know that there was a lot of pivoting from on-site to virtual mechanisms in the care, and that also there was some positive news that the members' engagement in the preventive care through the carriers seems to have been rebounding overall in 2022. So, getting sort of back to addressing those personal health needs. In terms of the Kaiser non-Medicare and Medicare groups, when we looked at the benchmarks, if we can go to the next slide. I'm sorry, one more. This one, yes. So when we look at these, we see that for those, we do that comparison for the against the benchmarks for other municipal retiree groups in the Kaiser Book of Business for this region. We see that there are some that are better, some that are similar, and some that are worse in terms of how LACERS compares to the benchmark. And for non-Medicare members, the rates were worse than the benchmarks for hypertension and diabetes. So it kind of relapsed a little bit in terms of that area, and also for having one or two chronic conditions. But we saw better rates compared to benchmarks for colorectal cancer screening, flu immunization, knowing their numbers, and staying up to date. For Medicare members, so the older retiree population, we saw that their rates were worse than the benchmarks for cervical cancer screening and getting connected. So those are some areas we want to keep an eye on. Again, it was probably affected somewhat by the COVID impact, but it's something that we want to try to keep an eye on and address and focus on going forward. Those were the main findings. If you want to scroll down to, through the slide just really quickly to get a flavor for what's in there, we can just keep going on down to the recommendations. But these are the metrics that we did for the comparisons for Kaiser and Anthem. You can refer to them for the purposes of time right now. I won't go through all of them. Okay, so the recommendations again are based on what the findings were for the continued health issues of overweight and obesity, prehypertension and hypertension, prediabetes and diabetes, and depression. So those are the ones for Kaiser we need to focus on. They're really very similar for Anthem as well. So just trying to make improvement in those areas, improve blood sugar control for diabetics, effective continuous phase treatment for depression, and also trying to increase member participation. And those flu immunizations for the non-Medicare members, so the younger retiree members, and cervical cancer screening for the Medicare members. Then we want to continue to increase the member awareness and utilization of the Kaiser's mobile app and virtual wellness and condition management program resources. That's something that I think we're going to continue to utilize now that the members have become more familiar with them, and also increase the collaboration as we're doing today with the LACERS Well program, other LACERS carriers, and community nonprofit health organizations. So continuing to foster that collaboration. Next slide. And then for the Blue Cross, as I mentioned, is pretty much the same in terms of the other ones. We see in the Anthem membership, osteoarthritis and low back problems are also issues to focus on. We still need to improve our ability to contact members for chronic condition management. For those that have those chronic conditions, it's always difficult to connect up with the members. So that's still an area for us to concentrate on with the Anthem members, and then increase the compliance with recommended preventive care, adult preventive visits, colorectal cancer screening, mammograms, and immunizations. And also increasing members' awareness and participation of those virtual telemedicine resources they have available, and the LARC diabetes prevention program, and using the Sydney mobile app, again, utilizing those virtual resources that they become more familiar with whenever they had to pivot to those resources. And then again, the collaboration between the various groups. So that's a really quick overview of a lot of data. I probably exceeded my 10 minutes by a few minutes, but I guess we can wait for any questions and answers later on then. So I will now turn it over to Crystal and Stephanie.
Thank you so much, Robin. You set me up for our presentation. I appreciate that. Good morning, everyone. I'm Stephanie Smith, Wellness Program Manager with the LACERS Wellness Program. I'm here to provide an update for our program to include our 2022 results, 2023 goals, proposed strategic initiatives, 2024 collaboration opportunities, and lastly, Crystal will present updates regarding new and exciting things happening with our Champion program. So with our program, we continue to promote a purposeful living campaign, with purpose being our primary element. Physical health, finances, social engagement, and community involvement all complement purposeful living. The research indicates that without purpose, we are less likely to pursue better health, finances, social interactions, or make an impact on our community. We strive to enhance the quality of life and retirement of LACERS retirees by providing them with resources and activities to promote optimal health and well-being. Our wellness program is supported by a small but mighty team. Our champion volunteers are the heart of our program. Their leadership provides our retirees with opportunities for social connections, physical activity, and better overall well-being. I'd like to introduce to some and remind others of the wellness team members. I'm responsible for the program planning and operations, while Crystal is responsible for the champion program and event management. Betty Smith manages the member outreach and supports our events. We have 2 admin interns, Catherine and Dawn, who support the administrative and event needs of the program. Lastly, we have amazing support from our LACERS leadership, Neil, Dell, Karen, and Ed Eliza. LACERS is one of a few retirement systems to have a fully developed retiree-focused wellness program. Our leaders, including our health plan partners and consultants, are critical to the sustainability of the program to ensure our mission continues for the greater good of the health and well-being of our LACERS retirees. So our 2022 program results continue to be impacted by the pandemic. However, we saw a substantial increase in 2022 in member participation from our 2020 and our 2021, as members took advantage of the virtual offerings available to them to learn and connect with other members. We maintained our high year-over-year rating, carrier webinars, champion volunteers, and nonprofit partnerships in 2022. This year, we have goals to slightly increase our program participation as we resumed our in-person events, maintain our high program rating, grow our carrier webinars, champion volunteers, and nonprofit partnerships. As I mentioned, we resumed our in-person LACERS facilitated events with our most popular topics, such as technology, estate planning, finances, and fitness. We expect a high turnout with our upcoming in-person open enrollment meetings, which have been scheduled for 3 locations. We have completed our virtual open enrollment meetings to permit members located within and outside the United States to have accessibility to the valuable information shared at those meetings. This past July, during our board meeting, we introduced 2 proposed strategic initiatives to further integrate health management with the wellness program. As you may recall, Robin's presentation recommended a focus on preventing and managing diabetes, hypertension, and depression. Although our current wellness programming includes webinars to address these chronic conditions, we propose implementing a health management initiative to address the carrier utilization reporting and include measurable goals tied to those initiatives. Additionally, we propose a nonprofit outreach initiative to expand nonprofit partnerships to align the health management initiative with the nonprofit program offerings as another layer of support to controlling and minimizing our cost to health and wellness programs. Implementing these initiatives through a collaboration with our health plan carriers, nonprofit organizations, and other agencies aligns resources to support more members and expands the program. Our next steps will be to reach out after the summit to health plan carriers and nonprofit organizations to move these initiatives forward and define our metrics for reporting. In 2024, our wellness program theme is Move, Learn, and Grow Together. There is much we can accomplish individually, but there's so much more that we can do together. We are excited to plan in-person LACERS workshops and new events in collaboration with our health plan partners. Our existing recurring virtual classes will continue to provide opportunities for members to participate at their convenience, wherever they choose to connect with their LACERS Well community. A new Aging Well monthly virtual class will start in January. The Aging Well classes will cover topics previously offered in the Aging Mastery Program classes, such as exercise, healthy eating, finances, and advanced planning. We invite our health plan partners to join in with LACERS Well to move, learn, and grow together. We've also developed an annual calendar, and that will be emailed out after this summit meeting. We encourage carrier partners to review and commit to co-facilitating in-person and virtual events with LACERS Well. I'll now pass it on over to Crystal Baldwin.
Thank you so much, Stephanie. As Stephanie mentioned, our champion volunteers are definitely the heart and soul of the program. With their support, we make the program locally accessible to our retirees. We are grateful for partnering with our champion leaders also. So let's take a moment to look at this calendar that's posted here. This calendar is distributed to our LACERS members on a quarterly basis. New champion activities have been launched, such as the Walk in Rolling Heights area, the in-person chess in Granada Hills, and a really popular activity, pickleball, which will be taking place in various areas and locations. There are currently a total of 21 champions in the program. Champion leaders and event volunteers enjoy exclusive LACERS Well swag, inside knowledge of wellness program information, and the opportunity to work alongside the wonderful wellness team members. We also look forward to collaborating with you, our carriers, as Stephanie stated, in the expansion of this program. We also want to encourage you to sponsor giveaways and attend a champion activity to motivate the leaders and participants to move, learn, and grow together. Now I have the pleasure of turning it over to an old friend and partner. Have been enjoying working with her for years. I'm going to now turn it over to Edith Monge of SCAN. Take it away, Edith.
Good morning, everyone. Thank you so much, Crystal, for your words. It's definitely a pleasure being here and being part of the LACERS team. So thank you for having us. I'm going to go ahead and just give you an overview. And thank you again, Robin, and all of you for the great presentation that you have given us this morning. I think it gives us a lot of insight of what to expect and how to help you all prepare for the years coming for 2024 and forward. So I took a lot of great notes, and I'm excited to bring it back to my leaders. So for today, I'm going to give you at a very high level an overview of our chronic conditions and disease management that we have in place. We work very closely with our delegated provider partners and to ensure that we can succeed in making sure that we are engaging our retirees. This is a very constant, and also very much appreciate the data that Robin shared, because I think definitely, although I'm not sharing any stats, the utilization data that was shared with us, from our two other the two other carriers that we work with, definitely the data is very much aligned with what we're seeing on our end as well. Just the increase of heart of disease, cholesterol, and all of the chronic conditions, we're seeing an uptick. So SCAN's philosophy of care, definitely we're here to assist and improve the access to the medical, mental, and social services, coordinate care teams through manage acute and long-term care and chronic conditions, develop individualized care plans for high-risk members, how we do this. We have a whole team in-house with case managers, nurses, and our social workers that work very closely, not just with our delegated medical groups, but alongside our retirees. Improve transition of care across healthcare setting and providers, ease members through the continuum of care for a safe, successful transition home from a hospitalization. We manage appropriate utilization of services. We also handle the telephonic ambulatory case management for members identified as high risk, and we empower members to maintain their independence and manage their health. So this is just an overview. And so how do we do this? Again, working along, next page, working along with our medical groups. We do have a pretty robust complex care medical management, a robust biomedical psychological assessments, medication reconciliation, data mining are working closely with ESI and our pharmacy systems that we have in place, individualized care plan and ongoing coaching and education via our case managers in-house along with the medical group, coaching for physician visits. This is a must, and it all starts from the moment that they enroll with SCAN, making sure that they can access their providers within the first 30 to 90 days and ongoing. And for that, we do an abundance of outreach, whether it's by letters, emails, and or telephonics. Disease management, we have a robust diabetes and congestive heart failure and chronic obstructive pulmonary disease. And for this, for 2024, I do want to share with you that we have reduced the co-payments for certain heart condition and diabetes drugs. We lowered the co-payments to $11 for these specific drugs. We've got to make sure that these retirees are taking their medication, that cost is not a barrier to them, especially because these aren't maintenance medications. Care transition. This is a short-term telephonic program with specific intervention strategies designed to ensure a smooth transition between care levels and prevent unnecessary hospital readmissions. So we got, the moment we find out that they're being discharged, our care management and care transitions get heavily involved to ensuring that they have the proper care in the home. And if it's on a short-term basis, that if independent living power is needed, then we make those arrangements as well, whether it's on a short-term or long-term. Our care navigators, we have a program supported by non-clinical staff that makes outreach calls to our members with gaps in care in an effort to assist members with obtaining needed tests and screenings. We all know that preventive screenings are vital. So when we see that those are not being met, we're doing an outreach to identify the reasons why and assist with scheduling those appointments. Next page. Care coordination. This is important. We want to ensure that our new members or existing members who are transitioning into a new medical group and or primary care, that continue to receive the services with no disruption by working with the new providers and organizations to obtain new authorizations. And we go as far as doing an outreach, whether it's another carrier to see if they're willing to share, pharmacy data, anything to ensure that the care is not being disrupted, specifically for those members who have a catastrophic illness, such as cancer and so forth. We've got to make sure that those services continue. Services can include specialty home health, chemo, radiation, scheduled surgery, equipment, and supply and rentals. Population health management. This is another program available. It's an outreach efforts based on continuous data mining, predicting modeling algorithms, and risk stratification. Health education materials, including member newsletters. This is something that needs to get done. We were doing it on a quarterly basis. Now we're doing it on a monthly basis. We got to make sure that we are outreaching to these retirees, providing educational wellness. Seasons are changing now, so now common colds are coming back. So just a reminder, flu shots and other preventive ways that are available. So I look to working with LACERS to see how we can share information, upload, utilize the microsites or any other ways that you can help us do an outreach to not just the SCAN members, but across the board, all LACERS membership. In addition, we are also doing an outreach and sending out notification to our retirees, reminding them of all of the supplemental benefits that we have within our programs, starting with our gym membership. This is definitely a great way for retirees to get out. And for those that are not able to go into a gym, our vendors are really good about now having online or sending out kits for these retirees to be able to work out at home or stretch their bodies. Lastly, in terms of care management, we do have the program for advanced illness. Our case managers and social workers have an advanced care planning that works directly with the family members in coordination with the medical providers for anything that is needed to ensure that we are providing the medical services and all the dignity that these retirees deserved during their last phase of their life. So we do provide a lot of emotional support for our members and family and caregivers. Next slide. Then I'm going to go into our independent living power. This is a very unique benefits that we offer, and they go back. These are the original benefits that the organization started with. And I have to share with you that, the LACERS retirees are really embracing this benefit on a short-term basis and also on long-term. We have over 25% of the SCAN LACERS membership utilizing some level of in-home care. And I am very pleased to let you know that for 2024, SCAN has increased the monthly allowance to $850. And it doesn't sound like a lot, but it's based on SCAN's contracted rates. So we make sure, or care managers make sure that based on the assessment, that they can certainly maximize every dollar for the month. And then following month, it starts all over. But it's an array of homemaking services like cleaning, grocery shopping, laundry, meal preparation. Their caregiver, if the retiree needs, they can also provide personal care assistance with bathing, dressing, home delivered meals, adult daycare, an emergency response system. We pay for the device and the installation, caregiver relief, inpatient custodial care, inpatient respite, and bathroom durable medical equipment. So this is a very robust in-home care. And again, it can be utilized on a short-term basis, recovery from a surgery, and they need the assistance for about 3-4 months. Or we have those retirees that need that extra help on a daily basis, and it's utilized on a long-term basis. These services are available within the Los Angeles County, Orange County, Riverside, San Bernardino, and San Diego counties. We're hoping that in the near future, we can expand to other counties and make it a full suite of benefits for all of LACERS population, regardless of the county. So that's something that we're going to be working on in the near future. Next slide. Again, for those that are utilizing independent living power or not, we have other solutions for caregivers, such as training. We have the senior sensitivity. We got to make sure that whoever's touching our retirees have that touch of senior sensitivity, since they have other needs and it requires a lot of patience. So helping our caregivers understand what our members are actually going through, it's just another level of care for our retirees, in addition with other emotional supports. We do offer chronic condition meals. This is, for all of our SCAN LACERS members. They don't specifically have to be in independent living power, but they can have a disease such as diabetes or any heart condition, and they have to be on a specific diet. We can certainly help with that. These are, again, meals that we provide at no cost to our retirees. And again, solutions for togetherness. We have an array of services available. We have a team of medical providers from our medical groups and in-house MDs that are going to be supporting the LACERS with community learnings and wellness events. So Stephanie, we can work together and make sure that we provide you all of the support that you need for all the upcoming events that are going to be on the books. Next slide. And again, being redundant here, but we are here to support you and the LACERS Wellness, and we're more than willing to contribute with what you need. I know that SCAN has already committed to a dollar figure that has been provided, along with our medical directors and physicians who are willing to support the LACERS team. So thank you for having us, and we look forward to working with you all. I'll go ahead and pass it over to Sandy.
Good morning, everyone. My name is Sandra Cunningham. I'm the account executive for LACERS here at United Healthcare. And I'm going to go over how we handle chronic health conditions on an HMO plan, as well as some refreshers of programs that we work with the retirees directly to help them live their healthiest lives. Next slide. So on an HMO plan, we really look to our medical groups to manage the members' care. They're under a capitation arrangement, which means we send monthly capitation payments to our contracted medical groups for each member enrolled into that particular medical group. Because the medical groups bear the financial risk of caring for our members, this is how we rely on them to really manage the chronic health conditions of your retirees. We rely on them to develop their own internal case management programs. They also have transition of care programs available to help with readmission reductions. And we have a program that goes along with that I'll talk about in a second. They also develop disease management programs to manage chronic conditions such as congestive heart failure, chronic kidney disease, and COPD. The way we incentivize our medical groups to can you go back one more? Yeah, one more bullet point here. The way we incentivize our medical groups to kind of develop these robust programs is because they manage the overall care for our patients, the more they retain their capitation payment, the more they work with them on chronic conditions, the more they will retain from our capitation payments. So they won't be paying out as much when keeping their patients healthier. Now you can go to the next slide. Thanks. So as a refresher, some of the additional programs that we give our retirees included in the plan. Next slide. Renew Active. So this is our gym membership that put into place starting January 2022. It replaced the Silver Sneakers program, but it's United Healthcare's fitness program that we utilize. It's available to all the Medicare Advantage retirees at no additional cost. Works just like Silver Sneakers. They keep the retirees active with a free gym membership at a location that they select near their home. If they prefer to exercise at home, they can access thousands of on-demand videos and streaming fitness classes. This helps them stay active socially with local health and wellness classes, clubs, and events. It also gives them the capability of connecting socially by joining the online Fitbit community where no Fitbit device is needed. It helps them stay focused with an online program offering content about brain health and exclusive content for Renew Active members. Next slide. Let's move. So this is a new program that was put into place earlier this year, and it helps the retiree join the healthy movement community. It's no additional cost to the member. It's here to help them keep their mind, body, and social life active with simple resources, tools, events, personalized support. This is an online program to kind of help them, as Robin was indicating earlier, beat the blues and stay connected. So they can join online cooking classes. It's along with Renew Active, they can get access to at-home workouts, locate any participating gyms and fitness events throughout the fitness benefit. Beat the blues. It's take time to care for their mental health with support services and online tools and resources. And they can also find activities in their area, such as volunteering events, to make new friends. So we're really happy with this program and excited for that to be offered to the retirees. Next slide. 24-hour nurse support. So along with the support they get through their medical group, we have a 24-hour, 7-day-a-week nurse line. Retirees can call the nurse line anytime. There's no additional cost. They can answer any question, or excuse me, ask any questions that they may need help with. When you call, it's a registered nurse that will help the retiree. They can help them choose where to go for care, whether that's self-care, a doctor visit, or urgent care. They can help them find a doctor or hospital that meets their needs at the time of the situation that's occurring. And they understand the diagnosis and help explore treatment options. So this is good if it should be a weekday, weeknight. Retirees just not sure whether they should go to an urgent care or emergency room. They have this support 24 hours a day with our nurse. Next slide. Personal emergency response system. So this is a program that helps retirees live in their own homes for longer. It's provided by Lifeline, and I always refer to it as the old I've fallen, can't get up. So the retiree can choose from 3 different in-home medical alert systems. It provides quick access in a situation should there be a fall, an emergency where the retiree needs a helping hand. And it provides safety, independence, and peace of mind for those relatives that know their loved one in the home is being taken care of. Next slide. Oh, that was all my slides. I'm sorry. I will now turn it over to Tammy with Anthem.
Thank you so much, Sandy. Once again, thanks, LACERS, for putting this together. Stephanie, I know you put a lot of time and effort into this, so this is exciting. So thank you for having us. I'm with Anthem, so I'll be talking about a little bit more of our resources and what we're doing through engagement. So for our member engagement in 2024, our goals are to improve the health outcomes, lower costs of care, and increase plan satisfaction by engaging those members through targeted strategic outreaches. So similar, I think it was SCAN, like trying to get that ability to contact all of our members and let them know and educate them about what is out there and available for them. So we really want to resolve their pain points by promoting the digital tools and resources that we offer. So similar to all the plans, there is that online system that we have either on the go on their smartphone, or they can register on their desktop if they aren't comfortable using apps on their smartphone. But this really helps them understand their benefits that are available to them. They can review their explanation of benefits, and they can chat with an online agent as well. And then, so our focus is to improve their health outcomes, so to increase their medication adherence for chronic conditions and increase their preventative care and screening. So we're all on the same page with this. I don't think I'm telling you anything you don't know, but it's really important that we all get on that same page and do this. So we also want to increase participation in their extra covered benefits. So we offer a lot. I'll go over them in a moment. And that increase in usage, it's there. So they should be using it to help get them going as well. And then address the pain points. A lot of times finding care, we are a national PPO plan. However, we encourage in-network usage because then Anthem has more control over, balance billing or what's not allowed. So we have control over that. We just want to help them find somebody who is in the Anthem network so we can assist with that. And then understanding that prior authorization. We're all in the same boat with prior authorizations. And I know that it can be cumbersome and sometimes members don't understand that it's not the plan. It's that the doctor doesn't really give us enough support for that. Or enough documentation. Next slide. So how we're using LACERS insights to create an engagement strategy. So this is just a generalization of the most common conditions, the top 10. So this is for all of us that are here today. So hypertension, that high cholesterol, arthritis, coronary heart disease, diabetes, on and on. So I believe the majority of us do have programs that will help the LACERS retirees really deal with that and try to get them into better outcomes. So 95% of adults 60 and older have at least one chronic condition, while nearly 80% have two or more. So that's a staggering number, and we're all here today so that we can really engage and strategize on how we can help the LACERS retirees with their health. So it's the power of preventative care. I know, I'm sure that Stephanie and Crystal are tired of hearing me every time I ever do any webinar, anytime I speak to any retirees, I'm always just encouraging them about preventative care. I can't tell you how many retirees I meet. I'm sure you do as well during open enrollments where you tell them it's $0. Go get your numbers. You should know your numbers. And some of them are like, I don't want to know my numbers. And you're just like banging your head against the wall. So really what we want to do is increase those screenings and increase those primary care physician visits, because only 5.1% of adults 65 and older receive their recommended preventative care screening. So once again, we're all in that same boat. So let's get them going into their regular wellness checks and their cancer screenings, because early detection, as you know, is key, and it will help keep the healthcare costs a little bit lower the faster we can identify that. So engagement goal of the preventative care is we aim to engage the LACERS membership throughout the year. So breast cancer screenings, colon cancer screenings, and those wellness visits. Anthem is doing community events throughout the year in Southern California, and LACER members are invited that if they live in a certain area, but we offer them, sometimes we'll have a mobile mammography screening, or we'll partner with one of the medical groups down there that offer it. The colon cancer screenings, we give away the lab kit so that they can conduct that in the privacy of their own home and just mail it in. And then we just really educate them. I know Robin was talking about healthcare literacy. We're educating them all the time about why it is important to have your wellness visits and to identify those potential chronic issues or illnesses early, because they're living longer now. And so, anytime we get a chance to say, you have grandkids or you have a great life, let's help you live longer. So adults that are ages between 50 and 75 who visit a PCP yearly are twice as likely to receive their recommended colon cancer screening. So just a little fun fact for everybody. So I know Stephanie had mentioned that there's a planning calendar. So this was something that we had put together just as kind of an idea. And Stephanie, I know you have one. So our effective tactics to engage membership in chronic conditions. So we offer silver sneakers. I know, everybody has their own unique health facility idea. I went through, and I know all of us pretty much contract with the same centers, those gyms. So hopefully Stephanie will be able to work on that a little bit more, but engage together, because we are all one team for LACERS retirees. But we do offer in-home screenings as well. And then healthy meal deliveries are definitely for those with chronic conditions. They might have obesity issues, and they might be underweight as well. And then also for those that are diabetic. And we want to coach them along with it too. It's not just here's your meal and eat good for 14 days and we're gone. It's also a lot of coaching with our care managements. And then we have campaigns throughout the year. And I always tell our LACERS retirees when I speak to, like, I'm sorry that you're probably tired of listening to Anthem calling you all the time, but we're all on the same page here. We know the importance of education and letting them know this is what's going on and this is why. So sometimes they, pick up the phone and help us along and get those PCP screenings, those wellness checks that are, it's time for your diabetic eye exam and such. So, and then we also do quite a few direct mail campaigns. It's a little bit easier to toss something, but at least I don't know about you, but I know when I get something in the mail, I'm like, that's right, I forgot, let me do it right now. So we're encouraging them to get those preventative screenings. And then throughout the year, I've actually been doing educational webinars to help members understand what their benefits are. So every single month, I focus on one area, whether it's in-home support or that healthy meals. We've done them on the fitness tracker, the transportation to and from care, assistive devices. So we take each of the benefits that we offer and actually educate them and tell them how to use the benefit. How can they access that benefit? What does it include? And then now, instead of reading it in a booklet and kind of glancing over it and forgetting about it, they're like, oh yeah. And I do get a lot of questions. So I'm excited to see the increase in participation. And then we have targeted campaigns focused on various chronic conditions. I think we all pretty much do. So that medication optimization I was mentioning, and then like pre-surgery depression is a really big one. Oftentimes when you're getting ready for surgery, it's scary and you're unknown and my age and they have a lot of questions. So we really like to focus on that as well. So that was the example of just kind of an engagement calendar that Stephanie will be sharing with us all later. And that was just our kind of, that's not LACERS, but that was just an idea. And then I'm going to pass it on to Sylvia Loftus. So she is our early retiree clinical director. Sylvia?
Thanks, Tammy. So here at Anthem, as well as, a lot of the other carriers that are on the call, we do have that total population health management. And I've been with Anthem for 15 years, and really, this is nothing new to us. We've always wanted to focus on that total person, bring in the behavioral health, bring in the financial, because we all know that behavioral health and financial stability really affects the medical part of the person. If they don't have access to food, they're not really going to go out and get the medications that they need. They're going to buy the food. So we really focus on that total person. So we have a bunch of different staff here at Anthem that are focused on the members. So we've got our utilization management team where the authorizations come into them and they're looking at that person to see if they need to be referred to case management. We have a primary nurse team that consists of our disease management, our case management, our complex care, our NICU. And I think, as Stan mentioned before, we also have a complex discharge planner that focuses on just assisting the hospital team with making sure that our members are discharged to those lower cost settings in a timely manner, but safely, making sure that everything is in place for that safe discharge, or possibly the transfer to even a higher level of care Sometimes members are in a hospital and they need that higher level of care. So we're working with the team at the hospital to get them transitioned as soon as they're stable to that higher level of care. And we have a lot of different specialty teams here at Anthem that really focus on just individualized diseases. We have, integrated imaging solutions, sleep management. We have family advocates. We have a new Building Healthy Families platform, which we're not only focusing on the members once they get pregnant, but we're focusing on helping them from preconception through delivery into that postpartum space as well. And then we have worksite wellness initiatives and health and wellness programs. And then we have the My Health Advantage notes that get sent out to those members whenever we do notice a gap in care. If those members aren't going out and getting the colonoscopies, or if they're not getting the mammograms, if they're not seeing their doctor annually, if they're not getting the care that they need, we will send them a note in the mail letting them know that we haven't seen a claim come in for that. And all of this information does get funneled to the primary care provider because he is the hub for the member. So the primary care provider is always kept in the loop with anything that we do here at Anthem. If we can move on to the next slide. So with all those different programs, we want to meet the member where they're at. So we actually stratify our members so that we're meeting them and giving them the appropriate level of care management to suit their needs. So we know that about 80% of the population falls into that healthy or at-risk bucket on that healthcare spectrum. About 20% end up with a chronically ill diagnosis or critically ill in the hospital, dealing with a bunch of different things that they've got going on in their life. But that 20% usually makes up about 80% of the spend. So you really want to keep the members in that healthy and at-risk bucket if at all possible. So when they're in that bucket, we're stratifying them, making sure that any lifestyle changes that can be made, they're aware of what's open to them and available to them. We're addressing their behavioral health. We want to make sure that if they have a behavioral health diagnosis, if they're dealing with depression, stress, anxiety, as we know, coming out of the pandemic, it's just more and more critical that we make sure members know how to access care in that behavioral health space. So we're making sure members are educated and aware, how can you get treatment if you're dealing with something in that behavioral health space. So we have a lot of programs to support members at this level. We have our Sydney Health app that has a lot of information on the different programs. They receive notifications so that when we notify that they do have a gap in care, we can alert them through that Sydney Health app. Then also the diabetes prevention program. So this is the program where we are reaching out to members that are pre-diabetic. So it's those members that are at risk for developing diabetes, but have not reached that level yet. So we want to try to keep them in that pre-diabetes state. And then it's all of our wellness programs that keep members healthy. But when members do transition to critically ill or chronically ill, we do have all of those programs. But at this point, that's when we bring in condition care, because that's when they actually have the diagnosis of diabetes or COPD or coronary artery disease or asthma. So we're actually seeing those diagnoses pop up, and that's when we start reaching out through condition care to keep them as healthy as possible and educate them about their disease processes. That's when we bring in the disease management team. That's when we bring in the case management staff. So for those members that are critically ill, they have a nurse to talk to about their disease process that helps them through, answering questions that they may have, that helps them through the healthcare system, because it can be very overwhelming. And when you're sick and you have maybe that recent diagnosis of cancer, it just becomes harder and harder to make decisions, to know where to go next, what to do next, what's important, what, can be maybe not done quite so urgently. So we're here to help them as they go through those things when they get those critically ill diagnoses. So we are looking at every type of support: financial, community, emotional, behavior, and physical, when we stratify these members and as we engage, because we all know it takes a village to help members out. So we're really pulling in all of these different aspects and all of these different teams that we have here at Anthem to help the member where they are. We can move on to the next slide. So for those members that are at risk, that have a diagnosis of maybe COPD or asthma, cancer, anything, we really want to intervene. We want to help them set up interventions that will keep them as healthy as possible, to educate them about their disease process. So when we interact with the members, we set goals, because as a nurse, my goal may not be the same goal as the members. So we really want to find out, what is the member's goal? Let's set a goal and help attain that, and then focus on maybe something that may not be at the top of their list. But as a nurse, as in the healthcare industry, we know that they need to also focus on this. So we meet with the members, we talk with them, we set goals with them so that the goals are very collaborative. And then we also send out the care alerts. So for those members, that even aren't enrolled in the care management platform, or we haven't quite engaged them yet, we still send the care alerts to them. We let them know we're here for them. And these are the things that we've identified that maybe you haven't done, like get that primary care doctor's annual physical done, or get out and get that colon screening or mammogram, or whatever it is. We're continually letting them know these are the things that we see that might benefit you, to keep you as healthy as possible so you can continue to enjoy your life. Next slide. All right, so that's it for the medical portion. I'm going to turn it over to our specialty team now, and I think we're going to start with Lola. Go ahead, Lola.
Hi, everybody. I'm Lola Knox. I'm Sylvia's equivalent on the specialty side. Specialty is our dental and vision. And I just wanted, I've been listening to everybody, and obviously the early detection and the engagement are two very important parts of this. And when we think about total population health, it needs to include the vision part as well, because it is part of that overall health. And I feel that, having the vision with the medical allows those extra touch points. It gives extra access to engage those members in their health. And knowing, some of the data that we're collecting, your membership, we're talking about the conditions. A lot of those conditions can be first detected on an eye exam, and people are going to go for their eye exam. It's a pleasant experience. It's not like having your preventative care so much, but you've got the ability to be speaking with the doctor, and that optometrist or eye doctor has information about that member, so they're seeing the total picture of their health. And as we think about how that data is used, it blends with the medical information, and so it's taking that information, and again, it's identifying more care alerts. It's notifying people of their eye exams and how important that is. When you think about high cholesterol, hypertension, diabetes, they are the three main conditions that you can see on an eye exam very early on. But some of the other conditions, macular degeneration, cataracts, this is going to be very prevalent with your members. And so managing that, given it's an age-related diseases, managing that's really, really important. So again, thinking about Sydney and or mailing gaps in care alerts, that kind of thing. Our care managers, again, they have the goals that Sylvia talked about, where they can bring awareness to those members about their eye health and the importance of going and getting their eyes checked. and keeping up that with the maintenance if they do have one of those age-related conditions. So again, using this information on one platform, like in a seamless way, providing those additional engagement touch points. As those claims come in, that data continues to, be added to that member's profile, so to speak. And so this is an ongoing condition events that we can intervene on. So if the member doesn't engage the first time, that doesn't mean they wouldn't engage the second or third time, because we know sometimes it does take more than one time of tapping someone on the shoulder to say, hey, this is really important for you. So if you're getting a medical notification and an eye notification, it's like sometimes it's the aha moment for members to make sure they're engaging their preventative health. So happy to be here today and appreciate the invite, and happy to help work and collaborate on any kind of member education as it relates to eye health. I think just the general understanding of the importance of it, what it means, and then how it does relate to overall health. So I know when I came over to specialty, I didn't really think about this as much, but now I realize, and have been working doing this, that there's a lot of education to the members to really just help them understand the eye health in general and what they could anticipate. So with that, I'm going to hand it over to Michele Dubois.
Thank you, Lola. My name is Michele Dubois, and I'm the Senior Executive Account Manager for Kaiser Permanente that oversees the LACERS account. I'll be going through a couple of different slides, as well as my partner, Jennifer Barrell, who is the Senior Workforce Health Consultant, will also be participating in today's summit with information on senior resources as well as self-care resources. Next slide, please. We'll be going over a couple of demographics, chronic conditions, senior programs, and self-care. Next slide, please. Here's a quick snapshot of LACERS demographics for Kaiser Permanente. Next slide, please. Chronic conditions. Chronic conditions include diabetes, depression, asthma, coronary artery disease, as well as obesity. Although obesity is not considered a chronic condition, it is included here as a significant precursor to the development of chronic conditions. In looking at these numbers, be aware that people with multiple chronic conditions, comorbidities, are included in each applicable chronic condition. A member with diabetes and depression contributes to the prevalence of both. If a member is diagnosed with depression, diabetes, asthma, and coronary artery disease, they are automatically enrolled in the Aligning Disease Management Program with Kaiser Permanente. Kaiser Permanente's disease management programs give members with chronic conditions a comprehensive range of integrated tools, resources, and services. Our strategy combines prevention, management, and when necessary, acute and emergency treatment. The programs are tailored for specific conditions, including asthma, cancer, chronic pain, depression, diabetes, obesity, and also cardiovascular disease. Members with or at-risk chronic conditions don't have to opt into our disease management programs. There is no additional cost. Next slide, please. These are just a snapshot of the LACERS members that are utilizing our disease management programs. Next slide, please. Now, the characteristics of Kaiser's Permanente approach is different and has been successful. Proactive. So using clinical data, members with or at risk for chronic conditions are identified and automatically enrolled in our disease management programs by their physicians. Members' risk levels and needs are assessed by effective evidence-based care and services support. Team-based and physician-led. Physician-led care systems and teams are assembled according to the members' care needs. It's comprehensive. A wide range of tools motivate members to effectively manage their conditions and care. System-wide. Electronic healthcare record systems link every Kaiser Permanente member, caregiver, hospital, and physician office in real time, helping to ensure accuracy and consistency of care. Our overall connected care program is for chronic conditions that are proactive and data-driven. Next slide, please. Kaiser Permanente wants to assist LACERS goals for an active and healthy lifestyle for all of their members. One of the programs that they provide is Silver and Fit. Silver and Fit is eligible for all Kaiser Permanente members that can receive fitness center memberships, as well as home fitness kits, thousands of on-demand worksite programs. Silver and Fit is also affiliated with Active and Fit, which is for our non-Medicare members. Next slide, please. Meal delivery. Meal delivery programs provide meals upon discharge from an inpatient stay at a hospital or skilled nursing facility. And this is made available to all LACERS members that have Kaiser Permanente. There are 3 meals per day up to 4 weeks and a total of 84 meals. Next slide, please. Transportation. Transportation is a program that provides Kaiser Permanente members with LACERS that they can get a ride to and from doctor's visits at no charge. There are 24 one-way trips, 50 miles per each trip per calendar year. The rides include doctor's appointments, medical services, picking up medications, as well as different types of transportation are included, which is rideshare and taxi. There are also wheelchair vans for those who are unable to sit in a private vehicle. I'd like to introduce Jennifer Barrell, who will go through our senior programs and self-care apps.
Hi, everyone. My name is Jen Barrell, as Michele mentioned. I'm a workforce health consultant at Kaiser Permanente. So happy to be here. So I support well-being. And I just wanted to make sure everyone's aware that we do have a specific section on our Kaiser Permanente website, which is specifically for seniors and mentions different resources that are available. So I would encourage, all of our members and the LACERS team, just to make sure they know about these resources. There's lots of different discounted programs and services that we have. So this is a great resource. Next slide. Also, I always love highlighting the self-care apps that are available to our Kaiser Permanente members at no cost. You may have heard me talk about these before, but they're such great resources. We just really want to make sure that, everybody knows about them. And so our Kaiser Permanente members are able to get the Calm app at no cost. The Calm app is great. If you need help relaxing, meditating, I love the sleep stories. Those are really great. Who knew there were sleep stories for adults, but they're great if you're having a little trouble sleeping. We also have a newer app, which is a partnership with the company Ginger. And this allows our members to actually text with an emotional support coach. So we know a lot of people are very comfortable text messaging, and this allows our members to get some additional support, emotional support, which probably all of us can benefit from, just with texting with an emotional support coach. So that also is offered at no cost through Ginger. And lastly, we have the My Strength app, also available at no cost. And My Strength app is a bit more personalized and basically begins with an assessment of how the member is doing. And then there are personalized plans and activities, things to read, things to watch based on how the members are doing. So again, lots of great resources for our members that we want to encourage them to take care of. And like I mentioned before, we have on kp.org lots of resources specifically for seniors. So we'd love to partner in continuing to get the word out about all of these resources, the ones I mentioned and the ones Michele mentioned. Okay, so without further ado, that's the Kaiser section. And now I wanted to pass it on to Michele Bodie.
Wonderful, thank you. Good morning. Thank you for having us today. I appreciate it. My name is Michele Bodie, Director of National Account Management at Delta Dental. I'm excited to talk to you today about the connection between oral health and overall health. I'd like to start with this visual that really showcases all of the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of different chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of premature death, premature birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities, tooth loss may result in serious mental health issues, including things such as depression, social anxiety, and low self-esteem. Our senior population is at greater risk for many of these oral health issues, including gum disease. A recent study revealed that the bacteria that cause gum disease are also associated with the development of Alzheimer's disease and related dementias, especially vascular dementia. I highlight this because a dentist may be the only medical professional that a person sees each year. Dentists are often the first to detect serious health issues, such as cancer, diabetes, and heart and kidney disease. In fact, at least 90% of all systemic diseases have oral manifestations. Maintaining good oral health is important at any age. It is important for people who will experience menopause to be aware of how this stage of life impacts oral health. An astounding 84% of women age 50 and older are actually unaware of some of the oral health symptoms and discomfort they may experience related to menopause. A recent survey that was conducted revealed that most women who are experiencing menopause are unaware of how dental providers can actually help them address some of the symptoms related to menopause and recommended treatments. Though 70% of women, 50% and older indicated that they've experienced at least one oral health symptom since beginning menopausal symptoms, only 2% have discussed these concerns with their dentist and only 1% with their dental hygienist. Menopause leads to changes throughout the entire body, including the mouth. Yet most women are actually unaware of the connection between menopause and oral health. The majority of women surveyed in this study didn't know that menopause could increase the risks of things such as dry mouth, gum disease, jawbone density, tooth loss and tooth decay, and also receding gum lines. Dry mouth and receding gum lines are the most frequently reported symptoms that women over 50 and older have noticed since experiencing menopausal symptoms. Arming women with the right knowledge about oral health is an important factor in promoting healthy aging and helping women make the best decisions for their overall health. Very few women 50 and older are communicating with a primary care provider about menopause related concerns, both general and oral health related, and even fewer are turning to their dentist. Awareness has an impact, as we all know, and we've heard on this call today, which is why we're dedicated to breaking this stigma and discussing menopause and the connection to oral health. Thank you for the opportunity to be here. We appreciate it. Have a great rest of the day, and I will pass it over to Stephanie.
Thank you so much, Michele. I just learned something new about oral health, so appreciate that. And at this time, I'm going to turn it over to Borden to lead a discussion around enhanced benefits forthcoming 2025 and beyond. I'm going to stop share so we can see each other. Is Borden on? There you go.
I'm on. Thank you. Well, I really want to thank everybody who participated and for all of the areas that well, for the deep consideration that you give the retirees. I think is probably the best way to describe it. It's wonderful. You know, at times some of you can be fierce competitors with each other, but it's also one of those where it's nice to see collaboration among the carriers relative to trying to do their best to serve the communities, the retiree community that LACERS is. So at this point, we wanted to have a discussion regarding, we've heard a lot of different ideas and so forth. I would be interested, and I want to kind of open this up to the carriers, especially, I think one of the areas in particular, the medical carriers, we all have our own little niche, but then we have dental and vision, which covers everyone. And so how do we coordinate early detection and the discoveries there with some of the other carriers? I'd like to hear if there's any thoughts surrounding that first. And maybe we ask Delta Dental and Blueview Vision, how is it that Delta, how would you best be able to coordinate the information from you to the medical carriers so that there's a greater consolidated effort relative to caring for the members?
Absolutely, and thanks, board. And this is Michele Bodie again from Delta Dental. Yes, electronic medical records is certainly a big component of that. At Delta, we have a program called SmileAway, which allows us to have a file feed between our medical carriers, where when members, LACER members, have certain health conditions, it's a list of actually 12 different health conditions, they get additional resources. For example, 4 cleanings a year, periodontal scaling, additional preventative work essentially for these diagnoses that are connected with an increase in oral health conditions such as gum disease. So that's one of the ways that Delta is addressing it.
And how do we, it's one of those, I'm very sensitive to HIPAA. We want to stay within the HIPAA guidelines. So it's not like we could just say, hey, Delta Dental, can you please give us a list of all those people that with those chronic conditions? We'll give it to LACERS. LACERS, you look up what plan they're in, and then we'll give it to each plan. We can't do it that way. So what, are there any thoughts, or is this something that's a takeaway of how we get that information back to the individual's medical provider as well too?
Sure. Oh, go ahead.
No, go ahead, Michele. This is Edith Monge, and we've had situations as such, and we definitely don't want our members' data going from multiple hands. So the preference would be encrypted directly from either Delta directly to Scan. So they would have to identify the plan and with your assistance, and it has to be securely sent to our organization.
Sure. Yeah, and we can absolutely talk with you all about that and how best to accomplish it.
Well, I think that might be one major outcome of today's summit, is that we should work to unify the chronic conditions identified through our dental carrier to the medical carriers to get all those people coordinated. That would be a wonderful outcome. So I think that's one of our takeaways from today. And then Michele, unless you have anything else to add, I would ask the same on the vision side. Annika?
Yeah, sure. Well, so
I'd imagine on the Anthem side, you're already coordinated.
Right, I was just going to say that. Yeah, so I mean that's the good thing with Anthem, is that we already have that data and we're already coordinating those efforts. So that's a benefit to having that integrated coverage. And in terms of, you know, what further we can do to really engage those members. You know, I think Lola really talked about what we're doing today in our care management, and along with Sylvia Loftus, you know, kind of how we hit members with those additional plans, you know, where we're identifying, you know, chronic conditions, you know, such as diabetes and heart disease and hypertension. I know Lola's on and, you know, could speak more to that, you know, as well. Yeah, I know we've had discussions in the past as well about, you know, how we really, you know, how can we really engage members to really start to get in and get their eye exams more frequently, or at least on an annual basis, you know, and because we know that that's such a first important step in terms of prevention, especially when it comes to chronic conditions. So I think, yeah, I think, go ahead. No, you go ahead, Lola.
I'm sorry, I got disconnected right at the minute. I was going to say something. I'm like, what's going on? Yeah, so Annika did talk about the information that we do have and being able to use that information. And again, the claims that come in obviously are key. And the optometrists and eye docs can actually code those claims with those diagnoses. So it's another way of adding to that risk stratification. And we do see that, you know, of course, a lot of people already have these conditions, but then we've seen across our book of business probably 10% of like diabetes, identifying diabetes, for example, is the first claim is coming in on vision. So, and I think as we're sharing the data, we're sharing it back out with our optometrists. It's all HIPAA compliant. And what it's doing is allowing those optometrists to be able to see the full picture of that member. So they're able to address gaps in care. They can let us know immediately they've addressed a gap in care. They're getting information to really, it could be various levels of information. But now it's a bi-directional kind of tool where they can actually put in biometrics back in. So things like blood pressures, pulse, height and weight, you know, so there's an obesity issue. So, you know, there's some things. I think the
question was more surrounding, we understand that. Those are great. And the communications between optometrists internally and even Anthem Blue View to Anthem Medical, we understand that those are happening. But we also have Blue View members that are covered under UHC and SCAN. And so how do we get that data to them as well too? I'd imagine one, it will require, because again, going back to, you can't send us a file to LACERS, and LACERS look at the data and then send it to the appropriate carriers. So we want to see what can we do direct.
Yeah, so we would be open to conversation about that, and to be able to identify others and be able to see how, what is it that we, you know, can kind of do in that regard. For sure. Love to talk about that.
Because the idea is, I mean, I love my optometrist, but unfortunately, I'm seeing my primary care physician a lot more. And so, you know, we want to coordinate that information. And I know every time I go, not every time I go, at least once or twice a year, my provider, a primary care provider asks me, did you get your eyes checked? And I usually have to report that back. And so in the same token, I know that there's information that my optometrist would prefer that my provider know about me as well too. So the question is, how do we get that to my primary care provider? And I think that's something we're not going to solve today, but I think we have a willingness from both providers, Delta Dental and Blue View Vision, to work on that as a goal going forward, to making sure that information is cross-referenced so that we can help the retirees maintain better health.
Absolutely. Thank you for the discussion.
Yeah, and that's just it, you know, and I think as we move forward into 2024, 2025, and yeah, I absolutely adore the future, because I think we're going to see a lot of very positive areas. In particular, I think the area of AI is going to continue to develop, and it's hopefully going to bring medical, dental, vision records all together into one cloud and make it much easier for the professionals that provide our care to us to coordinate all that. But I would be interested in knowing what of the carriers right here and what you've heard of from each other, and is there anything in particular that you're going to be taking back to your organizations, maybe trying to develop more? Any ideas that you received from this? A big goose egg, nothing.
Well, I know this is Tammy from Anthem, and you know, as we had mentioned, we all, you know, the chronic conditions and the illnesses are pretty much the same over us all, and most of us have the majority of the same kind of health benefits. But one of the key things I took back was really focusing on that caregiver too, as far as the support for them, not caregiver relief as much as like more support for family members. I was really impressed by that. So something to really take back and sit there and say it's not just the member, it's their family helping them out as well.
And I do want to say over the over the past, I would say it's especially the last 6 years, we have pushed you carriers have responded beautifully. The membership has much greater enhanced benefits above and beyond just you're going to cover our claims, you're going to show them where the providers are. There's so many enhanced benefits, and for those we are truly grateful. And I know that especially one of the big things that is coming down the pipeline that I'm kind of interested in knowing is there's supposedly could be as early as 1/1/24, although I think most people are now thinking it might be 1/1/25, and that is long-term care requirements that might be I believe the federal approach is to let the states individually handle it. We know this California is very closely watching what's happening in the state of Washington. Are there any developments on with the carrier sides relative to long-term care enhancing benefits in that region?
Hey, board, it's Felicia with Anthem. So from the Anthem side, there's nothing it's in legislation, right? So our compliance and legal teams are watching and see how that plays out and contributing where necessary to different organizations that have those conversations with the government. So nothing firm yet. We're definitely watching it. One thing though, I think that was to answer your earlier question about an important component maybe that I personally took from the conversation here with the other partners is post onset of COVID. I think what we're seeing now is this emergence of really high critical claims and the cost to them. So the past couple of years, starting with 2020, where we really saw DEI and SDOH take off because of the situation that we were in with the pandemic and how those efforts were really important to managing just the behavioral health of the general population. I think that's kind of lulled at this point because what we're seeing come from the data is there's been a significant rebound in going to get care, right? Whether it's medical, whether it's dental, whether it's vision, the rebound is significant. And there are really high claims that are being caught because for whatever reason, there was a deferral of care. So from Anthem's perspective, where we're really focused on looking at towards, and from a roadmap perspective in the next couple of years is how do we get to those members? How do we ensure that they're engaging in everything that we're doing wherever they are on the spectrum, whether it be enrolled in a medical plan or enrolled in a vision plan? And how do we make sure that we intervene, make sure they're getting their preventive care, and then working with their providers? I heard Michele earlier mention like the EMR, the AI that's really taken place behind that, being able to proactively capture where we think members might be seeing a diagnosis come through is really something that we are focused on digitally here at Anthem. So I would just throw that out there that, really managing the critical illnesses that we're seeing come out of the onset of COVID is our focus here.
Wonderful, thank you. And one of the things that you touched on briefly is kind of one of the next areas. Biggest, well, not the biggest, but I agree wholeheartedly with you relative to it just seems like claims prior to COVID that were routinely handled. We still had our occasional large claims, but that absence of care has resonated in the form of much larger claims now that we're trying to catch up on. But in the same token, one of the areas that deeply concerns me is in the area of mental health. I think if I look at the utilization for LACERS on each one of your for each one of you, mental health is kind of almost doubled. I mean, it's always been a small percentage, but the fact that it's probably the one that coverage that increased the most relative to number of participants and so forth. What is there anything special that you're doing on the mental health? And I believe substance, they kind of report those two together. Substance abuse is in there. I think substance abuse is a lesser issue of the two, but certainly mental health is an area that I'm concerned, especially for our retirees. It's wonderful that it's an uptick, but in the same token, it does tell us that there's a greater need. And given, we're aware of the provider side, mental health providers are very difficult to find at this point too. So I'd be interested in comments relative to how you see meeting that demand, what some of your trials might be, where you've been successful, or what you're trying to do as an organization.
Hi, Borden, this is Edith. I can tell you that SCAN is definitely committed in making sure that, again, mental health is accessible, not just from our medical groups, partners, but also in terms of benefits. So it was actually too late to offer it to LACERS during the RFP. However, SCAN has committed in offering the behavioral health via our telehealth. So, and it's being offered in 2024 to all of the SCAN membership under the individual plan. So we're hoping to bring it on to LACERS for 2025. So again, I feel comfortable saying this so that all partners can definitely take advantage and see if we can add this behavioral health to the LACERS plan under the telehealth component. So this is another avenue, is on a confidential basis outside of the medical group. So that's something that we're going to do. And then with your question about long-term care, I have to tell you that our independent living power benefits here in California under the Department of Health are viewed under the long-term care clause. And I know that our lobbyists continue to lobby at a federal level to ensure that that we can add it back and receive funding. At one point when the organization started and we were what they called a social HMO status, we were receiving funding for those benefits, but that went away in the year 2000. So we've been funding the independent living power at SCAN for our group retiree sectors, and we will continue to do so. But if we can open up independent living power for all, that would be phenomenal. We will definitely be in a much better place.
And I guess the lobbying effort at the federal level under this is really one of, is it just basically looking to free up more money under, obviously for Medicare services at this point, to help fund the independent living?
It's to allow the Medicare Advantage plans to offer the independent living power.
Got it.
Under the bids.
How are other Medicare carriers that are on the how does it, I mean, you may not know, but I'd be interested if you could get back with me if you don't know, or if you do know, please share now. Any efforts at the federal level going on relative to CMC and LTC? Well, we live in a world of acronyms.
This is Sandy at UHC, and I'll have to take that back and get back to you, Warden, because I haven't been updated on any kind of long-term care benefits, but did want to chime in on the topic of mental health. I think that's why our teams developed the Let's Move program to kind of get those retirees engaged, you know, the social activity that they can look for. We also have the behavioral health virtual benefit option for retirees. So that's available now to all of them. But really, I think we're excited to get that taken care of through our Let's Move program.
Cool.
And similar to Sandy, same thing. I have to take it back for the long-term care. I'm actually taking a class right now on that. So it's very interesting that you're talking about it. I'm really excited about going back for that. But on the behavioral health side, we board in at every single webinar that I do, I put Live Health Online. I encourage them. Anytime I talk to Crystal and Stephanie, know anytime I have a chance to say anything in front of all the members, I always encourage them to use Live Health Online, because we have psychiatrists and psychologists as well as licensed therapists. So the psychiatrists can technically, you know, they're not obviously opioids or anything like that, but it's a really good connection of that they don't have to wait 2 weeks, 6 months, try to find that. But we have Member Connect as well, that it's the employees that volunteer and they call them and their phone pals. And then the member resources support that we try to set them up with other people too. So.
Thank
you,
you.
And I think that Warden, with that really ties into what our overarching strategy is at Anthem for getting members access to behavioral health. It's really virtual, right? So brick and mortar, we know that they're overwhelmed. How do we promote virtual? How do we get them connected and have all the tools and resources at their fingertips for that virtual connection? That's our approach there.
Yeah.
Right. And I will also mention that Anthem, over about the last 18 months, we've brought on about 4,000 to 5,000 more behavioral health providers. So we are really, really out there pounding the pavement to get providers on board with Anthem, because we want them to be able to utilize services at in-network providers. And we all know that behavioral health, there's a lot of out-of-network usage, especially when you're seeing more of the specialty type or are going to an inpatient, outpatient, residential treatment type setting. So we've really pounded the pavement, and we've been able to bring a lot of providers on recently. And I know the data has also shown that in the telehealth space, that is where behavioral health has stuck. So even though we talk about bricks and mortar building providers, those providers are still seeing members in that telehealth space. So it really opens up the possibility to have members utilize Live Health Online or all the virtual providers that all the carriers provide, because now you're kind of talking apples to apples, because if they get an appointment with the bricks and mortar building where you may have a little bit longer wait, they can see a provider through Live Health Online a little bit quicker, because it's going to be the same now. To where before the pandemic, we were trying to get people, you know, to utilize Live Health Online, but they didn't necessarily want to. And now it really doesn't make a difference, because a lot of times they're going to see that provider in the virtual space as well. So that's what Anthem's done it as
Thank
well.
You. Yeah. Michele, would you say the same is true on the Kaiser front? Pretty much that I mean, obviously your model's a little bit different, but you probably have the same pressures relative to the need for mental health services, and that I'm not going to say the push sounds bad, but the direction is to use more virtual online providers into that area.
So for us, Kaiser Permanente, as the last couple of years have extended our model not only to internal providers, but also outside contracts. So that's our big push as well, is really diversifying our providers, both, you know, in our integrated system and outside, but also just making sure that there's availability, again, as others have indicated, both in person and virtual, as well as conversation.
Thank you.
And
You
I
know,
just-
yeah, go ahead. Sorry.
Yeah, no, I just wanted to add to that we definitely agree that there are not enough providers for the need. And so one thing we're doing to improve that is we have a mental health scholars academy. And what that's really designed to do is to take from people who are existing employees at Kaiser and train them for those that want to be able to become like a licensed therapist. So I know I have a colleague who's also a well-being consultant in San Diego, and she's now part of the mental health academy because she's looking to be a mental health provider. So I think we're also looking within to develop talent at Kaiser because we recognize there is a need for more folks to provide that type of care.
Gordon, I have a question, sort of related, really, because what I've learned through the RFP process also is that one of the things that's impacting the healthcare industry right now is the shortages of care, shortages of nurses, of just like what Jen was just recently talking about, training staff to certain specialties and whatnot. What are you guys seeing out there? What are your plans within your specific organization in terms of because I know we can't just keep on raising how to call it salaries, right? To keep them within your organization, but there's certainly shortages in nursing staff, doctors, even dental industry. We're seeing PPOs getting impacted because they can't keep up with the inflationary increases, but at the same time a lot of dentists retiring and whatnot. So what are you seeing out there? What are you guys doing within your industry to to get those help?
Sure, thanks, Karen. One of the things that we're doing through the Delta Dental Care Foundation, which is our philanthropic arm, is giving scholarships. For example, giving scholarships to those folks in dental school to help promote, for example, doing practice in rural locations. Because as you know, quite often we struggle with meeting the need in some of the very rural locations. So through our care foundation, one of the things that we're doing to encourage is through scholarships.
I know, Michele, I know Kaiser's made a huge commitment to adding to the provider roles recently, and you've been very active there. Can you share a little bit about that?
So the active roles, can you expand on a little bit? I want to make sure
No,
that
you've been hiring a lot of providers in general. I think was the statistic that I saw last, over 5,000 providers or something like that were added, and there's another goal to add through 2025, I believe, as well.
We've added about 9,600 providers throughout the organization for a variety of different roles. As you can understand, recruitment and just overall, as Karen indicated, is tough right now in the medical field. We have a variety of different programs within Kaiser, actually encouraging some of our operational folks to consider medical programming. We are offering tuition to our employees if they'd like to go into the mental health aspect, as well as going to medical school, nursing school. So we're actually providing tuition reimbursement programs for some of our own employees to look at those different programs.
Thank you. I think the craziest thing, I actually have a medical center located in a rural area to incentivize providers to move to their location. Not only do they have a full relocation package for the family, they have a relocation package for the in-laws or the parents, so that that family will move there and they can move their parents there as well too, and have a supportive system. And I thought to myself, wow, it shows you how desperate we are, but in the same token, it also shows how creative we are. So thank you for that. I did want to come back to LACERS for a moment because we've heard wonderful ideas, and I want to use the mental health kind of as an example. The push is to go virtual. Is there an opportunity to do, and because when it comes down to it, it's like these are great programs. Now, how do we get the members to engage? And so is there an opportunity to come up with a communications campaign, something where our carrier partners can help us in promoting virtual mental health online? We're probably doing it individually, but not collectively as a whole. Stephanie or Karen, any thoughts on that?
Well, we definitely welcome those ideas. I mean, certainly when we went from from the pandemic going through the lockdown, we definitely, I mean, Stephanie was new to LACERS, so they definitely pivoted very, very quickly from having an on-site events all over Los Angeles to actually having our webinars, our various webinars, and we've been partnering up as you can see. We've been reaching out to various carriers. We partner a lot with Anthem. I know Stephanie's also been reaching out to Michele and reaching out to the other carriers to see where we can partner up with some of these webinars, because some of our members through the lockdown, it actually got them interested and trained using their laptops and their computers and their phones, which is great, because prior to that, as you can imagine, because folks have ambulatory, sometimes they have eyesight issues, they have problems with their computer, but somehow the community started assisting them, right? And one of the things that actually what we're noticing in our wellness program is that it's not just, even though they're participating, let's say, in a computer class, it's not just a computer class, it's actually a social class for them to be engaged in. And that's really what we're seeing. And it's funny because we have members that are complaining and they're saying, well, I don't understand why, you have these wellness programs. What does it really help the members and whatnot? But, the social aspect, that's something you can't, you can't recreate automatically, and it's at their home. And once in a while, I jump in some of the webinars, and you see the repeat of members coming in various aspects, various how to call it. They came from various types of jobs when before they retired, right? And they're all basically gathering, for that social aspect more than listening in to the technical side. So that's definitely what we're seeing in that particular topic. But we do monitor, for example, with Anthem and Kaiser, we once in a while when we do our annual meetings, we do monitor it's in terms of the percentage of members using their apps, using their computers and whatnot. The one thing that we're finding, though, the Kaiser side, it's a little bit a bigger percentage because they go to the same how do you call it? They have a centralized type of system as opposed to like Anthem or other maybe HMO type that's not as centralized. But you're seeing the numbers. You're seeing the numbers up because people, as they retire, they're much more technologically advanced. But that's what our mom's computer classes are there for as well. Hopefully to to get them engaged and get involved in that kind of activities.
Thank you, Karen. Stephanie, I want to be mindful of time. Are we over right now?
We are.
Okay. Then I just want to thank everybody for participating. And I think we have a couple of things that I think really seeing how we can coordinate the carriers, our dental and vision carriers, with getting data back to providers at all of our medical carriers. I think that's going to be one initiative there. the carriers have promised to kind of keep an eye on LTC as things develop. I think from a LACERS perspective, I think Karen, and tell me if I'm misspeaking for LACERS, but there would be an encouragement from LACERS to continue to lobby at a federal level to have Medicare funding available for LTC as well too. I think that's a good initiative there. And then relative to mental health, really we'll on the LACER side, we'll try to do a collaborative communications campaign, really to show members how easy it is and how encouraging it is to use virtual services as an alternative to visiting in person, and make that, you know, I just have, we've all been trained. Thursday, we all thought this meeting was going to be in person, and then so quickly it turned into a Zoom, and it's like, no big deal. And there you go. So, you know, retirees take a little bit longer. I get that, but in the same token, you know, we can work that as well through as well. So yeah, so I think that campaign, and then I think in general, LACERS and Keenan, whenever you're doing something, and you're always doing remarkable things, but especially along the lines of increasing your providers, things that you're doing to increase the number of providers within your networks, please let us know so that we're aware of them, so that we can, again, it's all about communications. And LACERS oftentimes, you know, this is going to be the sad part that I'm going to share with you. A communications from a carrier versus a communication from LACERS, which one do you think the retiree is most likely to read, and which one do you think the retiree is most likely put in the garbage can? Yeah, so we really want you to partner with LACERS so that we can make sure that they get the information they need. And yes, so I'll turn it, Stephanie, I'm going to turn it back over to you and to the LACERS team.
Okay.
But I want to thank all the carriers for their participation and their wonderful presentations and ideas.
Very much so. Thank you so much, Gordon. And I would be remiss to also, if we have any of the, we call it the CMR WC participants from the other municipal retirement systems. We call it the California Municipal Retiree Wellness Collaborative. If we have any representatives from LACERA, LADWP, LAUSD, City of LA, you know, thank you for your participation. Do we have any, just wanted to find out, do we have anyone on currently?
I don't think so. If they are,
I saw Leilani.
Leilani from LACERA.
Hey, Leilani, thank you so much for participating. I hope you got a lot out of this.
I did. This is a really great presentation, a lot of educational information that I can actually take back to our organization and to help us. Obviously, have our first time ever in-person workshop that will be happening next year. So it's our first time ever since pre-COVID. So a lot of great ideas, great discussion. Thank you so much for inviting us.
Thank you so much. Anyone else?
Yes, my name is LaShawn McLeod. I'm with Los Angeles Department of Water and Power. And thank you for inviting Department of Water and Power to this presentation. It's a lot of good information.
Thank you for joining us, LaShawn. We appreciate it.
Stephanie, you're muted.
I guess that would help, huh? Before I give it over to Karen and to Dale to close this out, if you can please in your chat have one word to describe today's summit, just one word.
It was great that we all carriers, we collaborated for, the same common goal.
Yes. And the fact that you all handed it off to one another, you could actually see the collaboration amongst your participation. Thank you so much for putting those into chat. We appreciate it. So with that, I'm going to give it over to Karen and to Dell.
Well, I just want to thank everybody again for participating. Thank you, LACERS, DWP for coming. We welcome any sort of collaboration with you as well, not just our carriers. Anyway, handing it over to Dale, our Assistant General Manager.
Hi, good afternoon, everyone. Good afternoon, our healthcare partners. So to me, this has been a terrific summit. For those of you that I have not met, I'm sorry I didn't get to meet you in person, but I am LACERS Assistant General Manager over our benefits operations, Dale Wong-Win. And I've been in this role since September 2020, but this is my very first summit. And so I'm giving all of you presenters today 5 Yelp stars. I'm very impressed with the thoughtful presentations and your willingness to share knowledge. But most of all, what really came through for me in hearing all of you speak is your commitment and dedication to the members. It was just very evident in all of the presentations. So I want to express my thanks to each one of you for your willingness to participate, to present your insights, to collaborate not only with us, but your peers across the industry. And I didn't see competitors, I saw collaborators, and I saw sharing commitment, innovation, creativity, and all towards, the mission of better serving our LACERS retirees. So, this is really important because our ability to listen to each other, we learn from each other, we grow together, and this only helps spark new ideas, strengthen the trust between all of us here, and continues to help us build a great wellness program that's both invaluable and impacts the lives of our retirees positively. So today, these wellness programs are for our parents, our aunts, our uncles, our neighbors, our friends, but in the future, these programs will be for us. So we are very invested in continuing to build this program, to build a valuable program that's well participated, well thought out, for our members, and doing so to make sure our members have a dignified, secure, and comfortable retirement, and making sure that we can pivot, as Bornan had mentioned, in an ever-changing environment, as you all have done so well during the pandemic and this morning. So in closing, just thank you very much. You have LACERS gratitude for participating today and for doing it in such a wonderful collaborative fashion. So thank you so much.
Thank you so much, Dale. With that, everybody have a great rest of your afternoon. Thank you.